I really do believe the government of Canada is trying to tell Canadians what they think about very controversial topics like drug decriminalization. And I'll get to some hard evidence that I've found that proves this point in a second. But first, I want to kind of just set the context. The province of British Columbia last year they decided to decriminalize the use of hard drugs in public spaces as well as in private settings. And the reason was it was to address the opioid epidemic in Vancouver in particular, downtown East Side, etc. Well, a year into this 3-year pilot, which was to go to 2026, the government of British Columbia is saying they no longer want to do this decriminalization pilot. They want to recriminalize drugs in public spaces. Specifically, they've seen community safety issues at parks, hospitals, schools, and certainly a lot of community members are complaining. They still want to make sure that drugs are decriminalized for private use, but not in public settings. Now, this is what happened today in the House of Commons at the federal level. I believe the federal government has to okay their out of the decriminalization policy. It was raised today, and I'm going to share with you a little bit of the debate. It got pretty heated, but here's what the leader of the opposition had to say about this issue.
The Honourable Leader of the Opposition.
Mr. Speaker, that, like everything else he says, is false. He uses fear and falsehood and this latest distraction because he doesn't want to face the fact that he has become so extreme and radical that even the BC NDP is distancing themselves from his decriminalization of crack, heroin, meth, and other hard drugs in hospital rooms, causing nurses to have to stop breastfeeding their babies for fear that their contaminated air might end up in the breast milk of the baby. Why won't he ban these drugs?
The Right Honourable Prime Minister.
We still won't condemn these groups. Any leader that needs the support of a far-right white nationalist group to fundraise and get closer to power does not deserve elected office.
Okay, so the Prime Minister did not answer the question. They went back and forth. In fact, the leader of the opposition was later kicked out of the House for describing the Prime Minister as a wacko Prime Minister pursuing wacko policies. But when it comes to drug decriminalization, the people I speak to are really not torn, but they're very skeptical about drug decriminalization. They don't know if it'll actually have an effect. I think a lot of Canadians feel this way. I think a lot of people in general feel this way. They're not too sure what this will mean for the community and society writ large, and if it will actually have a tangible impact. People sometimes point to Portugal and other jurisdictions that have decriminalized drugs and allowed for the small possession of small amounts of drugs as great examples. But, there's a whole host of other policies that exist in addition to drug decriminalization. There's health policy, there's a policing policy, there's security policies. There's a whole host of other policies that I don't think Canadians generally would be okay with. It's a big leap. But forget what I think and what I've heard from Canadians. The government actually put forward Canadians' knowledge and attitudes around drug decriminalization. Results from a public opinion research survey. Now, again, mind you, the people I talk to, they're on the fence. I think most Canadians, most people in general, are on the fence. So I was curious to see what this survey would say. So the survey says that it used 2 separate random samples of 2,000 Canadians aged 18 and older, and they questioned them on attitudes towards people who use drugs and decriminalization. Now, this was run between February 27th and March 12th, so very tight window here. Questions on knowledge of decriminalization were run between April 17th and April 30th. So a couple of weeks. They ran samples 2 separate times with 2,000 Canadians. I'm hopeful that this is representative of the Canadian public. I hope that's it, or Canadian population. But if you scroll down, this is where it gets interesting. throughout the report, it says X% of Canadians prefer a focus on access to health and social services. It's not of Canadians. It's of the respondents in the survey. Now, unless, and I didn't see it in the report, there's nowhere in this report it talks about how the survey was designed to be reflective of the Canadian population. So the fact that the federal government is putting out a survey saying, Canadians' attitude, and they don't tell us how the respondents are reflective of the Canadian population, puts into question the rest of this report. Here's where it gets interesting. It says 88% of Canadians, again, not respondents, Canadians said they would like their friends and family who use drugs to feel comfortable talking to them about it. 81% had empathy. Again, I'm not sure that those numbers are accurate of what Canadians actually think. Here's where it gets even more interesting. Although 62% of Canadians felt that decriminalization would make it easier to access health and social services, 51% also thought it would increase harms associated with substance use, such as overdoses. So we can see right there, in so many words, the federal government, through this public opinion survey, which I question, is planting the seed as to what Canadians think when it comes to drug decriminalization. Now, we may think that this is just one survey, it's not representative, How do you think governments make their policies? They cite research like this. They say that, by the way, the federal government's done a public opinion survey, and we found overwhelming evidence that Canadians want drug decriminalization. That's precisely the power of these research documents and the power they have, particularly when they're commissioned by the government of Canada. So when these research reports aren't statistically relevant and are being cited by the government, they have real power in how our public policy is being crafted. And so if they find that 62% are in favor, or they see it as a good way to access health and social services, of course the government's going to try drug decriminalization. Of course they're going to keep trying this despite the real, actual opinions that Canadians have, because the opinions Canadians have are far different, in my opinion, than what this survey represents. Now, I'm just going to share with you a graph, and I'll leave a link below to this so that you can check it out for yourself. Attitudes towards approaches to addressing substance use. 49% say focus on access to health and social services. I'm going to skip over the 35% one. If you go to the third column, focus on police enforcement, such as criminal charges, 7%. And then 35% say both approaches are equally appropriate. So clearly the government wants you to think that most Canadians are focusing on access to health and social services, such as drug treatment centers and recovery programs. Now, this is where I question that conclusion. Forget the survey for a second. I question that policy conclusion, if that in fact is the policy that the government's putting forward, for this very reason. I don't think that someone who's using drugs as a result of drug decriminalization is suddenly going to start thinking, I need to start accessing health and social services. And I know that sounds flippant, but that's how this policy makes you think that's going to happen. They think that a drug user is going to suddenly start saying to themselves after drug decriminalization, let me check myself into rehab, let me check myself into a medical institute, a medical facility, or go talk to a social worker. How that logic follows, I'll never understand. I think what they're thinking is that if they make it more socially acceptable, that somehow there will include a lot more social support for the individual where they are. Again, I would question that line of thinking, because I haven't found any research that supports that line of thinking and that trajectory of that individual. Certainly, I think there's a possibility that could happen over time, but that's over time and a series of psychological interventions need to happen in that person's life. So we have to listen to what states like Oregon and the province of British Columbia are finding, because they're actually implementing drug decriminalization. But I'm finding that the federal government of Canada is much more concerned with having you believe that this is a progressive policy and we have the quote-unquote stats to back it up. I think, to be completely honest, this is a clear example of the government using a survey to justify a very far out there policy that has been tried in many jurisdictions and has not worked successfully. And yet they keep trying. And my question is, why are they pursuing, these opinion polls that are forcing you to think that Canadians think that way when it's clear they don't? What do you think? Do you think these opinion polls are reflective of your opinion on drug decriminalization? Let me know in the comment section below.